Welcome to today's special interview where we have the unique opportunities of speaking with pancreas to my father's corner and insulin in the middle.
Hello.
And beta cells.
Hi.
We're going to be talking about type 2 diabetes mellitus or T2DM. Let's dive into the conversation and gain insight into pathophysiology and clinical manifestation of this prevalent metabolic disorder. And I'm going to start with pancreas. If pancreas, insulin, and beta cells, thank you again for joining us. So I'm going to start with pancreas, and it seems like pancreas is already sleeping there. Can you explain to us about the pathophysiology of type 2 diabetes?
Sorry about that. I'm just really exhausted. Yes, the pathophysiology. Some people are genetically predisposed to type 2 diabetes, but mostly this disease is brought on by excessive sugar intake and a sedentary lifestyle. This leads to increased insulin demand. I try to compensate by secreting more insulin, but over time I become exhausted, and anyone would. Unfortunately, this results in a failure to keep up with the body's needs. Cellular insulin resistance develops, causing the cells to resist all of the hard work and insulin I have secreted, and sometimes I just feel like giving up.
Exactly. The resistance triggers a vicious cycle. The pancreas secretes more insulin to overcome resistance, but eventually it cannot maintain glycemic control. Blood glucose levels rise up, and the patient may become dependent on insulin injections.
The major pathophysiological process here is insulin cellular resistance. The cells resist insulin, promoting the pancreas to produce excessive amounts. Eventually, this leads to the dysfunction of the pancreas and a rise in blood glucose levels.
Well, pancreas, you sound a little bit tired there. Are you okay? All right. We're gonna talk about the clinical manifestation of type 2 diabetes, and I hope pancreas doesn't seem like I'm picking up on her. So pancreas, do you mind telling us?
Well, it's really similar to type 1 diabetes, and this includes polyuria, polydipsia, and polyphagia.
Polyphagia, or increased hunger, occurs due to the lack of glucose entry into the cells, causing a sense of starvation.
Polyuria results from fluid shifts due to hyperglycemia, leading to diuresis in the kidneys. And polydipsia is excessive thirst. These two together mean you'll probably be going to the bathroom a lot. Pancreas, do you have anything else to add?
I would like to add that type 2 diabetes is associated with metabolic syndrome. This includes hypertension, dyslipidemia, hyperinsulinism, and an apple-shaped body.
Weight reduction, increased physical activity, and pharmacological treatment can improve these symptoms.
Thank you so much, guys, for that. I'm curious about the complications that arise from type 2 diabetic.
I can tell you.
Pancreas.
Yeah. The complications include hyperosmolar hyperglycemic syndrome, or as I like to call it, HHS. This means that your blood glucose levels are over 600.
And to add on, dehydration is a major mechanism of HHS, causing osmotic diuresis and electrolyte imbalance.
Dehydration is a major mechanism in HHS, causing osmotic diuresis and electrolyte imbalance.
I just said that.
What?
It's like you've never listened to me.
I'm sorry, it's not
That
my
is the
fault.
whole problem.
It's my receptors, they don't work, they don't want to listen to you. I'm sorry, insulin. Anyways,
Never listen.
the complications affect various organs, such as the heart, blood vessels, kidneys, eyes, and feet.
I see there's a banter going on between beta cells and insulin here. So, but that is very interesting information. How does type 2 diabetes affect the heart and the blood vessels? If you don't mind telling us.
Pick me again.
Thank you.
Thank you. I love this. So, diabetes increases the risk of cardiovascular diseases. This is like coronary artery disease, heart attack, heart failure.
Elevated blood sugar damages blood vessels, leading to atherosclerosis, stroke, and peripheral artery disease.
Alright, I'm gonna pick on beta cells this time. So beta cells, do you wanna talk about how it affects the kidneys?
Sure. Yeah, long-term diabetes can lead to kidney damage, progressing to chronic kidney disease and end-stage renal disease. Not good.
That doesn't sound very good. And what about the eyes? Pancreas?
Well, I thought you would never ask. So high blood sugar, well, it damages the eyes. It damages the blood vessels in the retina. It causes diabetic retinopathy, and that's definitely going to cause some vision problems.
And to add on to that, blindness can occur if not managed.
So that sounds so awful. I didn't know it did all that. How does type 2 diabetes affect the feet?
Oh, I know. Diabetes harms the feet due to reduced blood supply and nerve damage, leading to issues like peripheral neuropathy, delayed healing, and increased infection risk. If you ever want to see something a little bit yucky, look up diabetic feet pictures, and if you like wounds, maybe you'll like it, but you need to have a strong stomach. But that is what can happen if you don't take care of your diabetes.
I don't think I'm gonna be looking at those feet in a while. And talking about the feet, what aspects of H2 assessment are crucial in caring about type 2 diabetes patients? Pancreas?
Well, I'm not a big fan of feet, so I'll take the conversation back to the eye. Regular eye examinations are essential to monitor for diabetic retinopathy.
And please pay attention to the mouth. People with diabetes are prone to gum disease due to the decreased saliva and the increased sugar levels.
Also, make sure to assess the kidneys for signs of damage, monitor the heart and blood vessels for cardiovascular risk, and inspect the feet for any signs of neuropathy or structural problems. I like to bring it back to the feet.
Those feet again. But wow, what kind of information is that? That information puts things to perspective. I think I need to get checked now to make sure I don't have any diabetes. And I see Pancreas with her hands up. If you want to talk about how I can do that.
I've been really wanting to tell you that there's a couple of tests that you should definitely do, and one of the most common ones are the HGBA1C and the OGGT test.
So a little bit about the HGBA1C test. It should show below 5.7, and a level of 5.7 to 6.4 is pre-diabetic. Anything above 6.4 is considered diabetic.
And for the OGGT, you want your blood sugar levels to be under 140 after 2 hours. 140 to 199 indicates pre-diabetes, and anything above that is diabetes. And this test, they like you to get done on 2 separate days to make sure they can confirm the number. It also includes a pretty yucky tasting drink, so be aware of that.
You have some yucky taste and some feet there. Well, this brings us to the conclusion of our interview. I want to say thank you to Pancreas, insulin, and beta cells for providing valuable insights about type 2 diabetes. Understanding the pathophysiology and complication is crucial for effective management and care. Thank you.
Thank you.